I'm now joined by Collette Shade, who is going to talk to me about an article that she wrote for the New Republic um, about psychiatric suggestions that have been going around about how to get through the COVID crisis and the economic crisis, self-help hacks at the end of the world. Welcome, Collette.
Hi, thanks for having me, Ben.
Yeah, no, my pleasure. Do you want to introduce yourself, talk a little bit about what else you've been working on?
Yeah, so my name's Collette Shade. I am a master's student at the University of Maryland School of Social Work. I'm studying to be a therapist, and I write about mental health and the kind of intersection of mental health and politics and capitalism.
Yeah, and so of course that's what this New Republic article is all about. So it kind of starts out talking about Maslow's hierarchy of needs and this sort of weird mini genre of self-help hacks to help people get through COVID and everything else. So can you start us off a little bit with what you were thinking about and what you were looking at when you got the idea for this article?
So this is something I've been pissed off about for a long time, long before COVID. And what happened was after COVID, I really started seeing an uptick in these pop psychology articles that suggested, well, if you just do this simple hack, that will fix your anxiety. And yes, it may have some impact. I mean, if I didn't believe that therapy worked, I wouldn't be going to school to become a therapist.
Right.
But obviously there are serious problems in our society that just, putting on a nice dress shirt to feel more focused during a Zoom call, or sticking your face in a bowl of water to calm down when you're feeling anxious. I mean, these are all fine things, but they don't really solve the problem, which is that people are broke, they're stressed out, and they're terrified of the political, economic, and ecological conditions.
Yeah, and even if this is something that's gone on as you say for long long before this, and I guess one way of kind of trying to enter into it is all of these things might help around the edges, it's not terrible advice that if you've been telecommuting and you never change out of the same t-shirt and pajama pants for the last 6 months, that if you like that, yeah, sure, maybe if you dress like you're going to work, maybe that will make you feel a little bit better, but the basic reason why they're the need that's being answered by all of these articles, all these little tricks and hacks, is something that goes way deeper than that. You quote some insane statistics at the beginning of your article about the number of people in recent months who've considered suicide. There's something much deeper going on here.
Yeah, I mean, the other thing I wanted to talk about too is that a lot of this really gets at how we understand mental health. Like the way we understand mental health, at least, or the way we've talked about it in the past few decades, is as this very individualistic thing. It's all about brain chemistry, which it is, but everything is about chemistry. So, I mean, you're a philosopher, Ben. I'm sure you can tell me what kind of a sort of ridiculous argument it is to just say, oh, well, no need to look at that. That's just about chemistry.
Right.
And so I think, but understanding it as that's the end of the story, rather than, yes, it is about brain chemistry, but why are these changes happening? Why did the suicide rate start going up so much after 2006? I don't think everyone's brains just spontaneously changed after 2006.
Yeah, right. So of course, right, like you say, sure, everything that happens to somebody mentally, right, you can tell some sort of story about brain chemistry, because we have if you don't think that that we're just like disembodied, Cartesian souls that are, that just happen to be linked to bodies, right? There's always going to be some sort of physical explanation. Uh, but that doesn't really tell us much about why any particular one is going on in any particular case. And you give an example early in the article about it's not even a COVID example, but it's just a general example about diabetes and
Yes.
nutrition that I think makes this point pretty vividly.
So there's a concept from the field of public health called social determinants of health, which is basically about if you see a trend like a big uptick or a big decline in some outcome, you basically want to say, now why is that happening? It's probably not spontaneous. There's probably some bigger reason. And so, for example, there are really, really high rates of diabetes in poor communities. And yes, that is chemical. Diabetes is a chemical condition. But the reason that so many people in these communities are getting diabetes, it's not just chance or random. It's because when you're poor, you can't afford to really take care of your body, to buy healthy food. You don't have the time to cook healthy food. You don't have the time or the money to exercise. And so all of these, now I'm talking about, to be clear, I'm talking about type 2 diabetes
Yeah.
here. You know, there are all of these things that just make it more likely that you're going to get this condition if you're poor. And so if you're looking at how do you help people who are in these communities that have these high rates of diabetes, what you really want to look at, if you're taking a social determinants of health perspective, is you want to say, okay, what's causing this? Oh, poverty. Okay, well, maybe let's give people more money. Let's give people, so they can buy healthier food. Let's, make sure that these neighborhoods aren't set up in such a way that there's no healthy options. But again, the money's the really important thing because they need to be able to buy it in the first place.
Right.
Why are they working 3 jobs? Maybe they should have some time to like rest and exercise and stuff.
Yeah, absolutely. And so when you do start talking in the article about COVID, right? I mean, like you make the point that we shouldn't treat this as if it were just like almost, it's almost like the neurochemical explanation, treating that as the beginning and end of it, right? We shouldn't treat it as if
Exactly.
as if COVID, like the actual virus itself, right? We're just directly causing all of the conditions that are leading people into such desperate straits right now, right? It's COVID is part of the background, but there are also a whole bunch of political decisions.
Yeah, they're decisions. It's not like people are like I saw this ridiculous headline that was like 8 million Americans slipped into poverty because of COVID. First of all, they didn't slip. They were fucking pushed by our policies. And second of all, it wasn't because of COVID. It was because of our policies.
Right. That there's nothing about so I mean, just for example, right? I mean, like lots of people, one reason why so many people are as anxious and stressed out and depressed as they are in the first place is because in America, losing your job comes with all of these other things. Most obviously, losing your health insurance, unless unless you happen to be married to somebody who is lucky enough to have their own employer health insurance. So many millions of people have lost their health insurance since the beginning of this, but that's not COVID took away their health insurance.
Right.
If we had national health insurance, nobody would have lost
exactly. And people would be a lot less anxious too. A lot of times, well, I mean, the way that the definition of anxiety essentially is having an irrational fear that interferes with your everyday life. But like, these are very rational fears. But the thing is, like, if you've got a bunch of stress hormones, if you've got a bunch of cortisol going through your body all the time, that has all kinds of negative impacts on your physical and mental health. Like one of the reasons people are having such trouble concentrating is that cortisol makes it really hard to pay attention, to remember things. And so if you're stressed out because you're terrified that you're going to lose your job and your health insurance and your home, you have all of these kind of subsequent effects where you're losing things, forgetting your keys and things like that. And everyone's just so needlessly stressed out, and there's such an easy fix for it.
Yeah, absolutely. And even with the jobs, themselves, there's this thing that conservatives in particular, do a lot, where they'll say it's not quite as bad as blaming the virus directly, but they'll only go one step up from that, right? And they'll say like, COVID lockdowns cause people to be impoverished, to be immiserated, that they have because this is so bad for people financially, and even that's not really true.
Right. The issue is they are bad for people financially because we've chosen not to support them.
Right.
And this is now I'm moving a bit out of my wheelhouse here, but it would be a public health measure to pay people to stay home. Because that would mean that they wouldn't be financially compelled to go out into the workforce and expose themselves, expose their families, expose people that they're, waiting tables for or whatever.
Yeah, right. Absolutely. So, and you also do talk, to maybe move a little bit back into that wheelhouse, say, okay, so there are lots of things, like there's lots of larger public policy things that could be done here that would dramatically alleviate a lot of the, or take away a lot of the sources of the anxiety and depression, that lots of people have been experiencing. Or maybe we don't even want to call it anxiety because it's given the definition that you just gave me, right? But the stress and unhappiness that we could give everybody health insurance. We could financially support people, support everybody, so they could make decisions about what they were going to do as far as work in the pandemic without this financial pressure. But it is, presumably, even if we did all of that, right, at least until such time that we either got like a vaccine or better antiviral drugs, or at least did like a serious enough lockdown that we could, use it to set up some sort of test and trace system to let people go back out after that. That while we're waiting for that, it is still like the germ of truth in blaming it directly on the virus, or at least on the lockdowns, is that just having a lot less human contact than you'd have normally is very, very bad, for people's mental health, even in the best of financial circumstances. And so one thing you suggest towards the end of the article is that we could do something about this, which is that we could actually just have a public program to hire lots and lots of counselors to help people through this.
Yeah. And this would be ideally also part of broader programs of public employment, such as the Green New Deal. But to talk specifically about a kind of COVID response, people are grieving. People have lost, members of their family, spouses, children, friends, neighbors, you name it. And people, it's really, really, really tough to get even off of a wait list to see a therapist, because the need far outweighs the number of providers. And then of course there's the financial component, which is a whole other issue, which is basically that the way things are set up, most people can't afford mental health care, or they're very, very limited in the providers and types of services that are covered under their insurance program, if they even have insurance.
Yeah, and even if you are lucky enough to have insurance, and you're even luckier, and it covers what you need, at least, I mean, God, even without bringing therapy really into it, even just like, even if you just are on psychiatric medication that you've been on for 10 years, and you just need that prescription every 3 months, that itself becomes incredibly stressful and upsetting because of the private health insurance system.
Right. It's crazy because it's like, um, you know, I love this message of like, yeah, go get help. Okay, stay on a wait list for 8 months while you're having a psychiatric emergency.
Right.
And then also, okay, you get off of the wait list, and then your insurance doesn't cover it, or you have to get it's like hundreds of dollars, your copay to see a
Yeah.
psychiatrist. I mean, it's just all kinds of different problems here.
Yeah, and even if your insurance does cover it, right? I mean, like,
Yes.
even if you're in the best possible situation, which is to say that you have a decent job, your insurance, covers the medication that you need. There's a doctor in plan who can write that script every few months. Then, if you do things like change jobs, even if you're going straight from one job to the other,
Yep.
or if you stick with the same job, but you know, hypothetically, I'm just pulling this example out of thin air. The university that you work for, decides to change, which insurance plan that you're on, and
Yeah.
then what that means is they say, okay, well, the doctor who used to write that every 3 months is no longer in plan. So now you
Right.
have to do some research. You have to find the new one who's in plan. You have to get that first appointment, which is going to take way longer because you're now a
Yep.
new patient
Yep.
again. Then, there might be a second appointment before
Yeah.
they're actually writing anything.
Yep.
And meanwhile, you're parceling out the pills. You say,
Yep.
okay, how many pills, how many days? And that's the situation of like middle class people with insurance that actually provides what they need. Never mind people who are just completely left out in the cold on this stuff.
Right. I mean, it's just like, and I'm actually writing another article for The Nation right now about this is not only about COVID, this is sort of broader focus, and it's about mental health awareness initiatives. And I got a bunch of, I put out a call on Facebook, on Twitter, different places, basically for stories about people, basically how people felt about mental health awareness initiatives, and how they felt that essentially the political and economic conditions had impacted their own mental health. And I mean, I was just completely overwhelmed by the number of people who got in touch with me saying things like, yeah, I was just on this wait list, or, I can't get care, or, it just feels like, there's one guy who said, yeah, awareness, it feels like such an insult to me. It's like there's this, it's like swatting at flies while there's a 20-foot pile of shit behind you.
Right. Yeah, and certainly, like, even when there is some public provision, like there's like a county mental health something.
They're incredibly overwhelmed. I mean, that is just
Yeah.
like, it's just the amount of providers to people who need the services is just totally out of whack. And what we need to do, which again, this is not particular to the field of mental health, this is, the same with like the field of public education. Like, we need to basically hire a huge amount of people, because that would both improve services, but it would also be a jobs program that would stimulate the economy,
Right.
and people would just be happier and healthier if they knew that they could get a meaningful job.
Yeah, you could actually get in to see somebody at the county mental health thing before, like, oftentimes these things are so overwhelmed that when you talk to them on the phone, they basically tell you, hey, if you actually have a breakdown, right, then you can come in,
Right.
right? But if you're just trying to avoid that, then whatever, good luck. Maybe if you can hold off for 2 months, then we'll see you then.
Yeah.
So I was curious also about this jobs program aspect, because this is something that you could speak to that I don't know. I mean, what is the kind of situation there? Like is there a massive pool of people who would fill these jobs, who are currently unemployed, or
So this is okay. Again, I don't want to say anything that
oh,
I don't know anything
right,
about. I don't know. I have not done a ton of research into this. Anecdotally, it seems like um, the biggest issue is, I mean, there are a couple things. One is basically that it's more lucrative to basically go into private practice and not take insurance or do sliding
right,
scale for various reasons. I mean, that's probably what I'm going to end up doing
right, of
after I,
course.
graduate and get a certain license and things like
Yeah.
that. But
Which, by the way, we left out of our litany of horrors of the private insurance industry before that, right? On top of all of that, right? If you have Medicaid, good
yes,
luck getting into a therapist who will take it.
yeah, I mean, um, yeah, I mean, I think, what was I saying here? Basically, uh, there's a big problem where there's just not a financial incentive to provide care to people who can't just pay out of pocket.
Right.
Um, and so, if there were a public jobs program, what that would do was that would create, in my opinion, it would create an incentive for serving, you know, a broader
Right.
swath of people.
Right. So in addition to like employing anybody who does have that training and just doesn't have a
Yeah.
job right now, and also, giving like people who might be considering going into those programs, more confidence that they'll get a job when they get out, right? So you'd have more people in the pipeline that way. It would
Yeah.
also let lots of people who might be who might actually be much happier if they could see a broader range of people, but who don't think they can justify the financial calculation, a way to do that.
Yeah, I mean, basically. And then the other thing is, I mean, I'm just a big advocate of jobs programs in
Hmm.
general. So, I mean, I'm a huge fan of the WPA.
Hmm.
Like, I love that we just paid out of work writers to do travel guides. We're just like, okay, you're a writer, cool. You're a painter, you're a photographer, cool. We'll pay you. Because that is, I guess my point is that, my sort of broader point here is that, creating an economy where people can know that they can support themselves doing work that's meaningful for themselves and for their communities, that's actually a mental health program. Because my kind of overarching thesis with a lot of the things I write is that we have to kind of redefine what we think of as mental health policy, because a lot of the things that are, for instance, a lot of the things that are making us so upset kind of fall outside the realm of what is traditionally talked about, even on the left and among progressives, as mental health policy.
Yeah, so let's get into that a little bit in the last few minutes we've got here. They so a lot of, like, you could easily see how somebody, who came from different perspective about this might say, okay, look, maybe a jobs program and Medicare for all and, all of the other things on that kind of social democratic wish list, maybe those would be nice things. But it's, what do those really have to do with the mental health stuff you're talking about? You're like, this is a stretch, like you're trying to, you've got this separate political agenda, and you're trying to present it as having something to do with mental health, but but really, I'm going to try to do a non-caricatured version of this, right? So I won't say really people just need to learn the ice water trick, and but like, but people who, but there are always going to be, I don't know, economic problems in people's lives. Mental health is just a separate thing from that. How would you like try to start to to make the connections for somebody who didn't start out seeing this the way that you do?
Well, nothing's really separate from anything, first of all. I mean, health itself is inextricable from our surroundings and from politics. And mental health is as well. And so we need to think about basically how humans are interacting with the world around us. Are we getting all of this input that makes us really stressed out and alienated and lonely, or forces us into these positions where we're uncomfortable or isolated or whatever? Or are we feeling plugged in? Are we feeling safe and protected? Do we feel like we have what we need? And there's been a lot of good research done on this. So one book that I like to recommend to people who are interested in this topic is called The Inner Level. It's by two British epidemiologists named Kate Pickett and Richard Wilkinson. And it basically, they crunched a lot of numbers. And what they basically found was that more equal societies have better mental health outcomes in a number of different ways. And so them's the facts,
All right, fair enough. Facts don't care about your feelings, but Collette does. So thank you so much for coming on, for talking about this. Everybody should read this article. There's a point early on where you say that maybe part of the reason why this analysis, isn't more widely presented is that it doesn't make for very clickable articles. But this is a entertaining and informative piece. So please go out and read that. Anything else you want to plug before you leave?
I mean, I'm working on this article for The Nation that's about mental health awareness initiatives. It's to come. And then I've also got another article that I'm working on for the New Republic that's about this weird trend of encouraging people to cry at work.
Wait, what?
Oh, you haven't heard.
I've missed this. You have to tell me about this.
Well, clearly you didn't receive the Instagram ad advertising a $40 t-shirt that says "I cry at work." And you missed the dozens of New York Times, Harvard Business Review, and Bloomberg articles about why crying at work is good, what to do if your employees cry at work, and things like that.
Okay. Okay, just real quick. Why is crying at work supposed to be good now?
I mean, from reading these articles, what I've basically gleaned is that it's supposed to be kind of liberatory, and you're supposed to feel like, oh, well, this is a safe place. I can cry in my office. But they never ask why you're crying in the first place. To me, if someone's crying at work, that tells me that there's a serious problem at work. And I'm arguing that basically we need to create workplaces where people don't cry as much. And the way we do that is by empowering workers and democratizing the workplaces.
Yeah, I mean, if you have a society where you've reached the point that your message to people who are in such bad places in their work situation that they're regularly bursting into tears at the workplace is don't feel bad about doing that. Like there might
well, but see, this actually ties into my sort of broader argument about like awareness, is that if awareness is a jumping off point to go either get help if that's possible and or make significant social changes, that's awesome. But like, if it's just like, okay, everyone be aware, hey, it's okay to have depression. It's like, okay, well, maybe we want to think about addressing some of the things, the factors that are contributing to it.
Yeah, right. I mean, like it almost seems like if you lived in a society where, I don't know, everybody worked at factories and the factories were so unsafe that it was super common that people would lose limbs in industrial accidents, and the solution was a bunch of New York Times think pieces about how you shouldn't feel ashamed that you have fewer limbs than other people
Limbs.
do, and you
This
should.
is literally what they're arguing. It drives me absolutely insane. I just feel, I
That's amazing. All right. Well, definitely look forward to seeing that in the Nation when it comes
yeah.
out. Please do come back to talk about it when it
Thank you so
does.
much. All right. Thanks, Ben.
All right. Thank you so much, Collette.
Bye.
Bye.